Classification of Marma points according to various Acharya. Classification of Marma. Name of Marma Acharya Sasruta Acharya Vagbhata. Mamsa Marma 1110. Sira Marma 4137. Sneha Marma 2723. Asti Marma 88. Sandhi Marma 2020. Damani Marma not explained 9. Name of Marma Acharya Sasruta and Acharya Vagbhata. Satya Pranahara Marma 19. Kalantara Pranahara Marma 33. Visalyana Marma 3. Vaikulyakara Marma 44. Rujakara Marma 8. Marmani Salyavasayard Hamadaharanti. Yasmaka Marmesu Hata na Bhavanti Sadhya. Javanti Tatra Yadi Vadyagunina Kasit Prapnavanti Vikalat Vamasamsayam Hai, Sasruta Samada Sararasthanam. Pratyakamarmanirdasa Sararam. The medical authorities have described the marma to have covered half in the scope of Salya Tantra, surgery, inasmuch as a person hurt in any of the marma dies presently, i.e., within 7 days of the hurt. A deformity of the organ is sure to result from the injury to one of the marma, even if death be averted by a course of judicious and skillful medical treatment. Point 29. Fundamentals of Varmastra Mudikugal, Knots, 30. Mudikugal can be explained in Varmam physiology as the points where one or more nerves meet. Though these mudiku are found in many places in the body, the Varmam text mainly talk about the knots on the spinal cord. There are 5 muiku which are called as Karanamrita Mudiku, Sara Mudiku, Tunnel Mudiku, Pasa Muiku and Kumbhaka Mudiku. Kaviraj Kunja Lal Bishagratna. An English translation of the Sushruta Samhita Vol. 11. Kolkata, 1991. 30 Information Courtesy Drive North. Shanmugam, reproduced from the book Basic Concepts of Vethasathi Medical Varmalogikaibhagam, Selbagam, 2nd edition January 2019, published by Thirumolar Varmalogy Institute, Coimbatore. First one is Karanamrita Mudiku. This is located near the topmost vertebra of the spinal cord, i.e. C1 or the atlas bone. This is not easily reachable from outside the body, so this mudiku is rarely used for treatment purpose. The second is Sara Mudiku. This is the meeting point of the cervical and thoracic bones on the spinal cord. It can also be referred to as the meeting point of C7 and T1 vertebrae. One can easily locate this muiku precisely when the neck is bent forward. The third is tunnel muiku. It is located 10-finger measurement below Sara Mudiku. If one measures from the base of both the scapular bones towards the spinal cord, in a straight line, one can locate tunnel mudiku. This can also be referred as T8 to T9 vertebrae. The fourth is Pasa muiku. It is located on the spinal cord where the 12th rib originates. It can also be referred to as the meeting point of T12 and L1 vertebrae. The fifth is Kumbhaka Mudiku. It is located in the lower portion of the spinal cord. This mudiku is at the joining of the 5 sacral segments, which is also called the sacrum. These 5 muiku absorb the energy from the brain and uses them for the needs of the body. The Siddhar realized that when appropriate applications are administered on these mudiku, it proved to be highly beneficial for the human race. Concept of mudiku in Agastya Varmasastram. Mudiku are 5 in number. Mudiku anatomical correlation. Karanadi Mudiku / Padari Marma C1 vertebrae. Valaya Mudiku C7 vertebrae. Tunnel Mudiku T10 vertebrae. Nangana Mudiku / Pasa Mudiku L5, S1 joint. Kumbhaka Mudiku / Mula Mudiku coccyx. Dasa Vayu 31. Vayu play an important role in transmitting the Varmam energy from one place to another. In the art of Varmam, these Vayu are called Dasa Vayu. Though the Vayu that prevails in the body is the same Pranavayu, it is referred to by Varmam texts by 10 different names, based on the functions it performs in the body. These are categorized into primary Vayu and secondary Vayu. Among these, the 5 primary Vayu are responsible for the fetal formation. When these Vayu are present in the human body at the right places, then the fetus will be healthy. The other 5 secondary Vayu function during the growth phase of various organs after the body is formed. These 10 Vayu together are referred to as Dasa Vayu or Dasa Prana. Though these Vayu are present in various parts of the body, it is imperative to learn and understand a few of those places and their functions. These Vayu and the Varmam points are closely related. Prana. Though prana prevails throughout the body, it stays and functions at the heart, the lungs, and the brain. It is the basis for the functioning of the respiratory system and life force. Udana. The Udana Vayu resides and functions 1 finger above the navel. It aids in speech in humans. Though it is located primarily in the navel region, it connects with the brain, the tongue, the chest and the stomach and performs its functions. This Vayu functions in the body for protecting the fetus and aids in speech. 31 Information Courtesy Drive North Shanmugam, reproduced from the book Basic Concepts of Vethasathi Medical Varmalogy, Kaibagam, Saibagam, 2nd edition, January 2019, published by Thirumolar Varmalogy Institute, Coimbatore. Samama. Samama prevails throughout the body. It plays a major role in creating the sense of touch of the skin. It also stimulates the digestive functions. This Vayu resides functions from the center of the navel. Apana. This Vayu functions from various locations in the body. It plays a vital role in the excretion of wastes from the body such as stools and urine. Similarly, it performs another significant function of inducing normal delivery during pregnancy. Varmam texts refer to the existence and functioning of this Vayu at more than 40 locations of body. Among those locations, it is important to learn about 2 places from where it functions. The first location is 1 finger below the navel and the second is at 1 finger inside the anus. This Vayu is also called the Keel Nak Vayu, Vayu that flows downwards. But one has to realize that spiritual sadhana or spirituality is possible only with the help of this Apana Vayu. It is also primarily responsible for the proper function of the muscle structure in the body. Vyana. Vyana is the foremost Vayu that helps in regulating all the Varmam points in the body. It stays and functions at the starting point of the 12th rib in the spinal cord. It also functions from the center of the heart. A clear understanding of the location of this Vayu is necessary to regulate all the Varmam points. Prana, Udana, Samama, Apana and Vyana are the 5 primary Vayu. Kurm. The Vayu Kurm functions in the region around the eyes. This Vayu functions from all the eye-related Varmam points. E.g. Navarmam is located in the chest region, but the Varmam texts refer that Kurm Vayu functions from this point too. So, we can deduce that Kurm functions and energizes the eyes not only from the eye-related Varmam points but also from other Varmam points in the body. Naga. Naga functions from the throat region. It functions along with the glands in the throat region such as thyroid and parathyroid glands. The word Naga is related to the word Nagam, meaning snake in Tamil, which is a venomous creature. The malfunctioning of the thyroid glands results in the increase or decrease in body weight. Hence it is evident that Naga and Apana are closely related. Krakara, Jirikara. The Krakara Vava functions along with the nose-related Varmam points from the region surrounding the nose. The same Vayu merges with Krakara Nadi and establishes connections with the bone joints, thereby energizing the bone joints. It regulates the natural changes that occur in the bone joints. Devdatta. Devdatta functions from the chest cavity. It aids in the occurrence of hiccup and vomiting in the body as per body conditions. This Vayu functions independently and along with Samama and Apana in the body. It functions from the intestine-related Varmam points. Dhananjaya. The Vayu, Dhananjaya exists at various places in the body. It is necessary that we learn 3 of these places. First is the center of the brain, the second is the lower abdomen at the left side of Kundalini energy and the third is on the inner side of the spinal cord. It aids significantly in the functioning of life. In certain parts of the body, this Vayu functions in lieu of Pranavayu. It is responsible for the inflammation in the body. It is the last Vayu to exit the physical body after death. Kurm, Naga, Krakara, Devdatta, and Dhananjaya are the 5 secondary Vayu. All the above 10 mentioned Vayu can reside and function from a single Varmam point. One single Vayu or more than one Vayu can also reside and function from a single Varmam point. E.g., all the 10 Vayu function in unison at Tillard Hakalam. In the Varmam 6 Vayu functions. In the navel point called a Nakalam, 3 Vayu function. At the nose-related point called Kanadikalam, only 1 Vayu functions. As these Vayu reside and function from the Varmam points, these points are called Varma Vayu. Adharam, Adharanal, 32. Adharanal, Varmam points. Adharam are as equally important as the Vayu in the study of Varmam. According to the principles of Varmam, the Adharam centers are also important storehouses of energy. The Adharam are the fundamental energy for the construction of the physical body. These are classified into 6, and when Turium is added to this list, it becomes 7 in number. The following table lists the Adharam and their associated Varmam points. Information courtesy Drive N. Shanmugam, reproduced from the book Basic Concepts of Vethasathi Medical Varmalajikaibhagam Saibagam, 2nd edition, January 2019, published by Thirumolar Varmalogy Institute, Coimbatore. Adharam Varmam points. Muladaram and a Kalam. Svadhisthhanam Kaladakalam. Manipurikam Ayol Kalam. Anahatam Navarmarn. Visuddhi Thummi Kalam. Ajna Tillard Hakalam. Turiam Kandai. All the above mentioned, adharanal function with the help of certain sound vibrations. These vibrations are spread in the form of subtle petals around the adharam. These petals are also storehouses of energy and aid in the Varmam treatment. They are Muladaram 4, Svadhisthhanam 6, Manipurikam 10, Anahatam 12, Visuddhi 16, Ajna 3, totaling to 51 petals. Turium has 1008 petals. These petals have to be considered as the alternate forms of energy of the body. Na with macron and their functions 33. Uyur is the basic component in the formation of nadi, and it is located in the brain. During the process of evolution of human body, Uyur divides and later performs its actions through manas, siddham, siddha, buddhi, and ahankara. Manas. Uyur. Manas siddham, siddha, buddhi ahankara. Each above said component are related to Pankavayu and their action is influenced by them, i.e. components of nadi system Vayu. Uyur Samanavayu. Manas Pravyu. Siddham, Siddha, Vayanavayu. Buddhi Udanavayu. Ahankara Apanavayu. Information courtesy Drive N. Shanmugam, reproduced from the book The 5 Approaches of Medical Varmalogy, 1, edition March 2015, published by Thirumolar Varmalogy Institute, Coimbatore. Pravayu circulates in the Pingala Nadi, Apanavayu circulates in the Idakala Nadi, and Samanavayu circulates in the Susumna Nadi. According to sage Tirumular, both Samama and Vayanavayu circulates in Susumna Nadi. Stimulation of a Varmam point will stimulate the particular Vayu, Na with macron, and finally reaches the target organ and stimulates it. This is the basic principle behind the stimulation of Varmam points. Pingala Nadi carries prana, and hence prana can be regulated through stimulation of Pingalan. As pra reaches brain, it forms prakti. This prakti moves in Pingalan and reaches Svadhina Kakra. When prakti touches Svadhina Kakra, it creates or converts itself as Apanavayu. When pranasakti touches the bindu, or center part of Kakra, it creates Vasi. Pranasakti, after creating Vasi, move upwards to the brain along with all energy and form serum. This serum is believed to circulate in peripheral nervous system, and prakti moves in central nervous system. Kayam means disease. Sarakayam means the disease caused by improper serum, and it affects the functions of PNS. Similarly, prakayam will affect the CNS and also related muscles and organs. Vasikayam will affect the entire body. To treat a particular disease, the Varmam point related to the diseased part is stimulated to create Vasi, and this supplies energy to the particular part and cures the disease. This is the basic principle behind Marmacikitsa. Selection of Varmam point also depends on the principle that which kayam has occurred, i.e. Sarakayam or Prakayam or Vasikayam. Initial diagnosis is done to find out the type of kayam and the Na with macron affected. After identifying the Na with macron involved, the Varmam point related to the particular Na with macron is selected and stimulated. Pajavarmam is located over or on the sides of Na with macron, Tadavarmam is located on the meeting point or on the branches of Nadi. Adankal are the place where Idakala and Pingalan meet. In this place there will be collection of enormous energy, and hence stimulation of Adankal will improve the energy flow to the adjacent structures. There are totally 101 types of Adankal. Tiravukal is a technique of bringing Vasi into the place of Adankal and giving a trigger-like stimulus so that the energy will get distributed throughout the body. There are 13 numbers of Tiravukal techniques. E.g. stimulation of Kauli Adankal, Kalakalam, located over the left and right hand will stimulate the Idakala and Pingalanadi, and this stimulates the left and right hemispheres of brain simultaneously. Varmam texts, namely Narambustram 1500 written by sage Agasthyar and Narambarai 1500 explains in detail about the course of Idakala and Pingalanadi. Generally, it is considered that Ayakalanadi is located in the right leg and Pingalanadi is located in the left leg. But in some places of right leg there may be Pingalanadi, and in some places of left leg there may be Ayakalan. Pressure and type of stimulation of Varmam point will determine the extent of its effect in the nadi. E.g. stimulation of Kalakalam with pause in between will energize the brain, and when the stimulation is done continuously then it will energize the upper limb. Amai Kalam is located in the Pingalan, and in this point the Na with macron takes 3 rotations and goes upwards to umbilicus and pancreas. So when Amai Kalam is stimulated, it stimulates all the parts where the Na with macron takes rotations, like in the place of pancreas. Hence stimulation of Amai Kalam is done for patients of diabetes mellitus. For further reference about the Na with macron system, Malayalam text called Pasikaratharavukal, 300 poems can be referred. Each Varmam point performs certain functions. Functioning of Varmam points. Each Varmam point performs certain functions. It is important to understand their method functioning. The functions are follows: receiving and spending energy, e.g. Molapuralgai Varmam receives energy from another Varmam point and spends the energy for the functioning of fingers. Receiving supplying energy, e.g. Kalakalam receives energy from another point and sends the energy to other Varmam points. Receiving multiplying, supplying energy, e.g. Vilang Varmam receives energy from another point, multiplies the energy and supplies to lungs, liver, stomach etc. organs. Other functions are: receive, multiply, transform, destroy, supply, e.g. Mudirakalam. Receive, multiply, transform, segregate, supply, e.g. Anakalam. Varmam points performs the above said functions. If one of the functions ceases it may cause excess energy or loss of energy in the particular Varmam point, and this causes disease. When these functions of Varmam points are disrupted, the functioning of the nadi, pra, dasavayu, vasi and pankabudam are also affected. The founders of Indian medicine and the Indian religious philosophical texts mention 96 tattva, body physiology. But only Varmam text specifies 100 of them. The difference in the number is due to the count of the Na with macron. The general opinion is that the nadi